Hello, in this video I'm going to be talking about, is the sun safe after cancer treatment? Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, sometimes while we're outdoors where you can hear the birds sing. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. So is it safe to be exposed to UV light, such as that in sunlight, even in the day that's cloudy, after being treated? I'm going to talk first about chemotherapy. Some chemotherapy agents make the skin more photosensitive or sensitive to light. And that's because they change the way the sun affects the skin and the way the skin repairs after exposure to chemotherapy. There are a few medications that are particularly known for this. One is doxorubicin, or adriamycin is the brand name. Another is methotrexate, sometimes the M in CMF, and then the F, the 5-fluorouracil, or 5-FU. These are the ones that we're most familiar with as causing sun sensitivity after you've been exposed to chemotherapy. Two other chemotherapy agents that can make the skin sensitive to sun are paclitaxel, the brand name of which is Taxol, and cisplatin. With chemotherapy, once the chemotherapy is out of your system and you're a month or so out of treatment, you're not going to have that same level of photosensitivity as you will with radiation therapy, which again is a prolonged effect on the skin, months, years, or even the rest of your life. Next, I'm going to talk about radiation therapy. Radiation therapy makes the skin sensitive to the sun essentially for the rest of your life, and only in the areas where you had the radiation therapy. So chemotherapy goes through your whole body. That's why it's effective at decreasing the risk of cancer coming back in other parts of your body. Radiation therapy is directed to a particular area, or if you have recurrent cancer, to another area down the road. And the most common area, of course, is the chest wall, breast, area above the clavicles, the armpit, so the chest area and the surrounding tissues. After radiation therapy, you may be sensitive in that entire area for years, maybe months, but you may want to consider that skin particularly vulnerable for the rest of your life. And I know this sounds scary, but better to know and be prepared and take the absolute best care of yourself than not to know and end up with trouble down the road. The next thing I'm going to talk about is endocrine, or hormonal therapy. Hormonal therapies, anti-estrogen therapies, have no direct effect on the skin in terms of its sensitivity to the sun. But there are some indirect effects. In particular, the aromatase inhibitors, because they lower estrogen, can lead to thinning of the skin. This happens with time in people whose ovaries are no longer working. The skin becomes less plump, and it's because the fat under the skin goes away that makes the skin thinner, and it might increase your sensitivity to sun exposure. You might burn more easily. Not nearly as well known or as predictable as with chemotherapy or with radiation therapy, but we want to be thorough. There's no apparent interaction between targeted therapies and some of the other newer therapies and the sun. We know immunotherapies can cause inflammation of the skin that does not appear to be worse when it's exposed to the sun, but it is a side effect of any of the immunotherapies. So what can you do? If you are used to tanning, if you're used to going to a tanning bed, if you're used to sitting out and baking on the beach, flipping over like a cutlet every once in a while, we would advise you not to do that for several reasons. A tan is actually skin damage. It's not a healthy response to the sun. It's because of skin damage. And because your skin will be more sensitive after treatment, increasing the risk of sun damage is not something that would be advisable. So staying out of the sun is really important. Did you know even one session in a tanning bed causes skin damage? So staying out of the sun, obviously, for prolonged passive periods, not where you're walking, but when you're soaking up the rays, is not something that's prudent to do, not only because of your skin after breast cancer treatment, but also because of the risk of skin cancer. We do know that being in the sun is really good for making vitamin D. Check out our video about vitamin D because we have some tips there as well as some important things you'll want to know. So what about wearing sunscreen? We do recommend a mineral-based sunscreen. Mineral-based sunscreens are more effective at blocking the sun's rays from getting to your skin. And in general, we recommend an SPF, a sun protection factor, of 30 or more. After about 45, you're spending more money and not getting more protection. So 30 or above is the minimum. You want to make sure to apply it ahead of time. It takes a while to absorb into the skin and take effect, so about an hour ahead of time. And then also be careful to reapply it every couple of hours. If you're going in the water, you'll want to use a waterproof type of sunscreen and make sure you reapply it. You may also want to use zinc, just the white stuff that we're used to seeing lifeguards wearing. You may want to put that on your nose, but also in the areas that were exposed to radiation therapy, if that applies to you, if it's not covered by your swimsuit, or if you think moving around will make that area exposed to the sun. As I mentioned, you can also wear clothing that has skin protection in it. You can buy long sleeve, breathable things that you can wear in the sun that doesn't cover your hands, of course, or your neck, but it is helpful to know that clothing plus sunscreen, as well as avoiding, so a hat, sunglasses, maybe a swimsuit that comes up to here instead of one that plunges, that in addition to sunscreen and limiting your time in the sun can all be helpful. Does this mean you never get to go on vacation again? Absolutely not. With the number of choices that are out there for things you can wear to cover your skin, and avoiding the peakest times of the day, so 10 o'clock to about 2 o'clock. In most parts of the world, the sun is at its most intense. That doesn't mean that there's no sun exposure or sun damage to your skin earlier in the day or at the end of the day. Just those peak hours might be a good time to stay indoors, have an indoor lunch, go to a museum if you're on vacation, or stay in your room and read a book, and then spend more of your time outdoors in the morning or at the end of the day or in the evening. I want to share with you 5 myths about sun exposure after cancer treatment. The first is, treatment's over, I'm now in the clear, I don't need to worry about my skin. Absolutely not true, especially with radiation therapy. We see prolonged problems with the skin many years or even your entire life after radiation therapy. If you're done with chemotherapy, you can go back out in the sun, but always wear protection, a hat, glasses, sun protective clothing, and sunscreen. The second thing is, I'm all done with treatment, I can start to tan again. Don't do tanning. Tanning is skin damage, and even one exposure to a tanning bed will increase your risk of sun damage, premature aging, skin cancer, and problems from your previous cancer treatment. Another myth is I need sunscreen only during chemotherapy and radiation therapy. I hope I've persuaded you, based on what I've said about radiation therapy, that your skin is vulnerable as long as you live. So you want to be really careful even after you're done with treatment, and keep wearing sunscreen. And the last one is that I only need to cover up, whether it's with sunscreen or clothing, in the summer. We know that there are UV rays, no matter how hot they feel, that can damage your skin year-round, and really any time of day. We know it's more in the summer. We know sunburning is more at risk in the summer, but any time that you're out, you are exposed to sun rays. Even if you don't sunburn, you'll want to protect your skin. Thanks for watching.